Hi guys, my name is Dr. Raj Sethi. I'm one of the resident doctors here at Spa 810 in Harrogate. I just wanted to show you this beautiful patient that I had and the transformation that I've done on her face from top to bottom. So in total, this patient had 10 mils of filler, that's 10 syringes. And you can see some quite staggering differences, but still so subtle and so beautiful that they look very, very natural. You don't need to have all of this done in one go. She did on that particular day for certain reasons, but actually you can split this up over multiple sessions depending on your financial situation and depending on what time allows and how much you want to do. I'm just going to talk you through what I've done. So firstly, we can see in the top here, we've actually got a wee bit of hollowing in her temples. And actually we can see a tiny little shadow in that area. And if I get rid of my pen marks, you can actually see what I mean. There's little tiny shadows, and we've actually filled that temple really subtly. And what that's actually done is it's lifted that brow upwards in this direction and given her this lovely brow lift in that zone. It's very subtle, but that's basically what my patients want. They don't want a situation where they can anyone can see that they've had anything done. They just want something very subtle. She's literally just finished here, so she looks a bit red, puffy and swollen. You can see her lip looks slightly asymmetric, but that's very, very normal. And naturally, if you look in her before photo, this side of her lip is slightly bigger, so they're going to naturally look slightly asymmetric when they're swollen, but when they're all settled, they're going to look completely fine. And normally within 3 to 4 days, they'll be probably half or quarter the size they are right now. Not everybody wants their lips doing, that's very understandable. So if we move on, we're going to do, also we did a tiny bit in her cheek at the back here, and then actually I concentrated on the kind of the deep fat pads of the mid face in this zone here. There are a few different fat pads that we've treated deep. And what they naturally do is they bring this beautiful central curvature to the cheek, which is incredibly feminizing and improves the light projection. So if I get rid of that lovely little line I've drawn, you can see this lovely light projection on the front of her cheek, which is really, really beautiful. And it really looks prominent and very, very feminine. You can see also the nose to mouth line has reduced from before. Which is a really lovely result, and that's just going to just gently soften and make her look quite rejuvenated. The actual lip itself, and again, lip isn't for everybody, but if it is, I mean, this one is very, very swollen now. She's going to be very, very settled in about 2 or 3 days. It's going to be mildly bigger than the current before photo. We can see if you look in the lip corners, I've actually lifted the lip corner up and improved the start of that downward pull, the marionette line. We've just tried to solve that for her and try to make that as stable and as structurally supported as possible. I've also done quite a lot on her chin and jawline. So you can see in the before photo, we've got heaviness in the jowl, and also notice we've got dimpling in the chin. And this dimpling is a sign that the bone has started to resorb away. It's dissolving away on a daily basis, and that's completely normal, happens to everybody. But we can see that the muscle in this area, called the mentalis muscle, is overworking, and it's really, really working hard. She naturally has a tiny bit of something called an overbite in her teeth. It's the way the teeth are aligned, the upper and lower teeth, and the way they align with one another. So that means her muscle on her chin is working extra hard to try and force her mouth closed when she's trying to be at rest. So we can see this dimpling, and actually once we've filled the zone up properly, and again she's swollen, this will all settle down as well, but we can see that dimpling is instantly reduced. You can also see in the sides here, we can see the fat pads in the jowl have also reduced in the amount of their shadowing and the amount of little hills and valleys that you can see, and these little nuances have become far, far more structurally supported and a lot more softer in their contours, and that just means she's got a more smooth, slick jawline, which is a lot more youthful and rejuvenating. We can also see something called the OG curve of beauty, and that's the curve that we see on the outside of the face here. We can see that her curve is currently like that. We can see there's a bit of a flattening in this zone here because of the lack of volume projection in the cheek, natural resorption of the bone, but here we can actually see that we've really beautifully rejuvenated that cheek volume, and it's dropping down really, really beautifully. So just gently rejuvenating that cheek has made a huge impact to her whole projection. She's loving the results, and these particular fillers will last 18 to 24 months. Took me about probably an hour to do. And yeah, she's obviously a bit puffy and a bit swollen. Interestingly, if you look here, the under eye area has also affected. You can see the groove under her eye, sometimes called the tear trough, and here we can see actually it's improved. Interestingly, I haven't put any filler inside the tear trough. There's nothing under the eye at all, but by improving that central cheek projection, we've actually improved that under eye zone indirectly, which is really beautiful. Anyway, as I said, these results will last approximately 18 to 24 months. She's had 10 syringes of filler, which sounds like a lot, but to put that into context, that's 2 teaspoons of filler, which is not very much at all. If you want to arrange a consultation, you're more than welcome. We're based at Spa 810 in Harrogate. The consultation would be free. You'd come in and we'd have a really thorough chat about your current issues that you're having, any problems you're facing, the indwelling anatomy you have at the moment, the possibilities and restrictions on what we can and can't do, and then put together some kind of treatment options after I've explained exactly what's going on with your face or with your body or whatever issues you're having. We'll put together a treatment plan that will outline in detail the benefits and the risks of each procedure and each option available. And then if you're happy to go ahead, we would then carry out the treatment with really powerfully scientifically backed, clinically trialed products and safe techniques. I'm a regional trainer for an international derma filler company called Teoxane, and those are the brands that I use within the clinic. They're incredibly scientifically backed and clinically trialed and show that they've got high levels of safety and longevity, which is exactly what my patients want. The consultation is completely free. If you decide not to go ahead with anything, that's completely fine. I would rather have 100 of those conversations than ever force anyone to have something they didn't want or regret. All the treatments are aimed to be as natural as possible. You can see directly here, just finished, she's going to be a bit puffy and a bit swollen. That will all settle within 2 or 3 days and she can go back to complete normality. If you're interested, get in touch with the team and I look forward to seeing you soon. Bye.